some great momentum in our chat box. But again, that's in the upper right-hand corner. So we want to hear from you throughout the event, your feedback, brilliant ideas, and any questions that you have. We'll have plenty of time to address those. So if you haven't already, go ahead and introduce yourself. And we're going to get started by, I'm going to share a little bit about Interact for Health. So Interact for Health promotes health equity to improve the health of all people in our region through grants, education, research, policy, and engagement. We serve 20 counties around Cincinnati in Ohio, Kentucky, and Indiana. And to amplify the impact of our work, Interact for Health currently focuses on 3 strategic priorities. The first is to address the opioid epidemic. Secondly, to ensure that children have access to healthcare through school-based health centers. And finally, to reduce tobacco use, why we're all here today. And we work towards this goal of reducing tobacco use and exposure to secondhand smoke by supporting tobacco policy change, innovative approaches to reduce tobacco disparities, and marketing efforts. So today we're talking about the state of tobacco use in Northern Kentucky. As terms of the agenda today, first I'll be joined by Megan Folkerth, Senior Program Officer on the Tobacco Team at Interact for Health, to talk about the new data that we're releasing and what might be behind it. Second, we know that data is only good when it's put to use in our communities. So Julian Collins, Community Outreach Officer at Interact for Health, will share some tips for engaging communities. And then finally, we'll talk with 3 leaders in Northern Kentucky who think about this issue every day. Dr. Lynn Sadler, District Director of Health at the Northern Kentucky Health Department, Tony Cox, Director of the Bracken County Health Department, and Brent Cooper, President and CEO of the Northern Kentucky Chamber of Commerce. And we'll have plenty of time for your questions for these folks. So please, again, feel free to, anytime you have a question, put it into the chat box. And before diving into the data and releasing our report, I'm going to turn it over to Megan Folkerth and ask her to take a step back and help us understand the root of tobacco and Northern Kentucky and everything, and why we're here today.
Thanks, Kelly. It's great to have you all join us today. We really appreciate it. We're excited to release this data specific to Northern Kentucky. So with all of the tobacco work that we do at Interact for Health, we often get asked the question, why did you pick tobacco use? Isn't that problem solved? Now, most of you on this phone call know that it's still a major issue that's driving poor health outcomes in our region. For instance, in 2018, Ohio, Kentucky, and Indiana were among the 13 states named Tobacco Nation because these states have significantly higher rates of tobacco use than the rest of the country. They constantly rank in the top 25% for decades, and this contributes to those poor health outcomes. So in the past 50 years, the smoking rate has decreased drastically across the United States. Yes, it remains the single most preventable cause of disease and death in the United States, Kentucky, and Northern Kentucky. So for decades, we've had one of the highest percentages of adults who smoke in the nation in Kentucky, which has contributed to those numbers. Each year in Kentucky, 8,900 Kentuckians die from smoking. And there's almost 120,000 of our youth that will die prematurely from these smoking-related illnesses. Now, tobacco also has a substantial economic burden due to the healthcare costs and lost productivity. So smoking costs Kentuckians $1.92 billion in annual healthcare costs, and then another $589 million in Medicaid-related costs. And then this doesn't even take into account the state and federal tax burden from smoking-related illnesses that everyone in Kentucky is paying. In addition to these financial costs that we see, smoking-related illnesses and diseases, deaths, cause productivity losses in Kentucky that amount to $2.79 billion annually. And then finally, I know we'll touch a little bit on this later, but we also can't ignore the most pressing issue of the day, the reason that we're all gathered here remotely, COVID-19 and its connection to tobacco. So evidence has shown that being a current or former smoker may increase the risk of severe illness from COVID-19, and we're certainly seeing that play out in our communities. So now I'm going to turn it back over to Kelly. She's going to begin to share that data, and we'll dig into some more of the specifics of what's behind that data and what we're seeing specific in Northern Kentucky.
Thanks, Megan. So I love starting and just seeing everyone's responses to the question about the favorite thing in Northern Kentucky. I think it's really good grounding and just a great reminder of all of the assets in our region, from restaurants to the people to the great organizations, and it's a lot of great pride and a lot to build on for our future. So at Interact for Health, we strive to be your trusted source of health information. And to that end, we're excited to release this new report today with local data on tobacco in Northern Kentucky. A link to the report will be on our website and shared via email with you right after this event. So where do these data come from that we're sharing? We conducted the Greater Cincinnati Adult Tobacco Survey. It's a random digit dial telephone survey of adults in this broader 22 county region that you see here. We've released a couple reports already from the survey, which you can find on our website. But today we really are diving into these 9 counties that you see here in green that are part of Northern Kentucky. And when we say Northern Kentucky today and reporting the data, we are talking about these 9 counties unless a distinction is made. So let's go ahead and dive into what we learned. So while smoking has steadily declined over the past few decades in the U.S. and locally, these geographic tobacco disparities persist across the U.S. Like Megan talked about, Kentucky and surrounding areas were part of what's called Tobacco Nation. And this is leaving Kentucky and Northern Kentucky lagging consistently behind. While 14% of adults in the U.S. are current smokers, 24%, that top bar that you see here, of adults in Northern Kentucky are current smokers. In this 9-county region, that accounts for about 80,000 people. And we also saw with our data that the more rural Northern Kentucky, here at 32%, Bracken, Carroll, Gallatin, Owen, and Pendleton, those together have the highest percentage of adult smokers. Beyond this geographic disparity, we also learned that tobacco-related disparities exist for certain groups of people, which is resulting in poorer health outcomes. For instance, we saw gaps in income in Northern Kentucky. So more than half of adults living in poverty and a third of those living just above the poverty level are current smokers. And this is significantly higher than those with higher incomes at 18%. Furthermore, we see that the tobacco product landscape varied and it's changing. So looking at that light gray bar at the top, almost 4 in 10 Northern Kentucky adults use some type of tobacco product. Of those, like I said, 24% are current cigarette smokers, 12% e-cigarette users, 9% cigar and cigarillo users, and 6% are smokeless tobacco users. And while the results presented here today are focused on adults, it's really worth noting the e-cigarette use has increased dramatically among youth. And as this current generation ages and becomes adults, this changing product landscape presents new challenges and potentially makes future progress uncertain. So we want to take a moment, take a step back from these data, and have Megan tell us a little of what might be behind some of these data.
So as you can see in the data, Northern Kentucky in general has consistently lagged behind the nation, as we've said. Part of that is this strong history of growing tobacco. It has really contributed to these rates. The tobacco industry has built upon that culture. They have deep roots in Kentucky, the way they market the products, and particularly in those more rural areas, as the data highlighted. One of those population groups that Kelly talked about that we know is more affected are those living with lower incomes. Again, marketing by the industry, as well as limited access to cessation services, has really caused this number to not drop as drastically as with other populations and other income levels. And then as we're starting to see those e-cigarette numbers rise, we continue to see new products come on the tobacco industry. So e-cigarette use has skyrocketed among youth. That's what we often talk about, but those youth are becoming young adults, and we're starting to see those numbers increase. And then the industry is always steps ahead. So they're launching new products. They launched one earlier this year, and we'll continue to see that so that they can continue to addict a new generation of smokers.
All right, so we're going to dive into our second topic, which is on secondhand smoke. Research has shown that exposure to secondhand smoke, even brief exposure, is harmful to health. And yet the vast majority of Northern Kentucky adults, 89%, agree. Yet too many Northern Kentucky adults continue to be exposed to secondhand smoke. Let's first look at home. So more than 2 in 10 Northern Kentucky adults allow smoking inside their home. Among those adults who do allow smoking in the home, almost 3/4 report exposure to secondhand smoke on at least one day of the past week, and almost half report exposure every day. Now let's look at the workplace. More than half of Northern Kentucky adults reported that their workplaces allow smoking in some capacity, indoors, outdoors, or both. Among those adults whose workplaces allow smoking indoors, outdoors, or both, almost 4 in 10 report exposure to secondhand smoke on at least one day in the past week, and 13 reported exposure every day. So we know that many Northern Kentuckians are protected from secondhand smoke at their workplaces, but we also know that the data are showing that certain groups remain exposed, which is really just perpetuating tobacco-related disparities, and particularly among the Northern Kentucky workforce. But we do see strong support across Northern Kentucky for smoke-free workplace laws. Among all adults in Kentucky, that number is 67%. And then you see here registered voters at 69%, overall, as well as by geography. And then we also see support, which you can read more about in the report, by political party as well. Megan, can you tell us a little more about secondhand smoke in this policy solution of smoke-free workplace laws?
Absolutely. So when we look across the country, there's 27 states, along with Washington, D.C., Puerto Rico, and the U.S. Virgin Islands, that have enacted these comprehensive smoke-free policies. Unfortunately, the state of Kentucky is not one of those. We have done some work on local smoke-free policy. About 36% of Kentuckians are now covered by comprehensive smoke-free policy on a local level. So that equates to 38 municipalities. In our region, the city of Williamstown in Grant County is the only jurisdiction with a comprehensive smoke-free policy. And Kenton County, we know, has a partial ordinance, but it has significant exemptions that it still leaves a lot of our workforce exposed to secondhand smoke. So when we're lacking these policies, we're not protecting our workforce, which leads to some of those numbers that we shared early on with lost productivity and increased healthcare costs. So in addition to that lack of smoke-free policy, why haven't we made progress there? The tobacco industry is so deeply rooted in our politics. In 2018, there was, a big push at the state level for increased taxing on tobacco products. And that year, one tobacco company spent almost $380,000 to lobby the Kentucky General Assembly. It was more than twice as much as any of the other 720 corporations and associations that registered to lobby that year. So they are putting their dollars in Kentucky. They are fighting these types of policies, and that's why part of the reason we haven't been able to see this progress. While there's still a long way to go, I think the data speaks to the change in the public support. We're starting to see, the support across political lines, across jurisdictions has really increased over the years. And that is thanks to public education, awareness from public health community coalitions, and many of the other partners that are on this call and that do work in Northern Kentucky and across the state. So now back to Kelly as we dive into some more of the data.
Awesome. So we're about halfway through sharing the data, and we want to hear from you again. If we were all in the room, I know we would be turning to one another and sort of sharing what we've been learning and engaging in so far. So I'd love for you to turn back to the chat box. I know you know how to use it. So just tell us what surprises you or what stands out to you about the data shared so far. So we'll let you chime in there as we move on to the third big takeaway, which is really around the culture of tobacco in Northern Kentucky. We know that tobacco use and that history of tobacco growing have been woven into Kentucky's culture for a long time. I grew up in a small community outside of Lexington, and I remember driving past tobacco farms all the time. So it's certainly something that is ever present. And the data here provide insight into some of the cultural and community influences of tobacco in Northern Kentucky. So first, we see that the vast majority of adults think that smoking is common in their community. Um, our friends and our family are using it. Over 6 in 10 adults have at least one friend who currently uses tobacco, and half of current smokers have children living in their house. And then finally, this is probably exacerbated potentially. These data were collected before the COVID pandemic, but we know that a third of current smokers reported high levels of stress at that time. And again, all of these things are signals and speaking to tobacco being part of Kentucky's culture. So Megan, can you tell us a little more about that?
Yeah, to add on to what Kelly has shared, that community culture plays such a huge role. So when people live, work, and play in places where smoking is perceived to be common, it just becomes that social norm that people believe is what everyone is doing. A lot of times we talk to kids and they perceive the tobacco use rate among their peers as significantly higher than what it actually is. Because it's just part of the culture and becomes part of their day to day. So when people have these close friends that smoke, it's part of their everyday experience, and then they're exposed to secondhand smoke. When children grow up in these households where people around them smoke, it's modeled for them, and so it becomes a generational thing that's passed down from parents to kids and so on. And then high levels of stress certainly play into this. There's everyday stressors that we have. I would say 2020 is probably more than any of us ever imagined stress related. And so there certainly are concerns that we'll continue to see tobacco use rates increase, or that we won't see the decreases that we had previously seen because of this stress and what it's doing to communities and to people.
Thanks, Megan.
And finally, Kelly's going to wrap up with some positive news on those that want to quit smoking.
Yeah. And thanks so much for chiming in. I saw, a question around, if we know the dangers of smoking, why do so many people start to smoke and keep smoking? And I think that cultural piece is a good reminder of that, smoking is an addiction. It's one that's easy to start and hard to quit. And we know, even from our data, how often, how many times it takes to quit before someone is successful. But like Megan said, one of the signs of potential future progress is that most current smokers in Northern Kentucky, 72%, want to quit for good. More than half have attempted to quit in the past year, and over 6 in 10 have been advised to quit smoking by a healthcare provider in the past year. And while we have a ways to go, I do want to take a moment to celebrate that 24% of Northern Kentuckians are former smokers, meaning that they have successfully quit. So we know that it's hard, but these folks do show us that it is possible. Megan, can you tell us a little more about cessation?
Yeah, so as Kelly shared, we need to celebrate these successes, and I don't think we can do that without recognizing the efforts of local and state public health agencies and our healthcare providers. When you're sharing this number that 62% have been advised to quit by a healthcare provider, we're certainly seeing progress in these areas. Community education is certainly essential. Kentucky participated in the CDC Tips from Former Smokers campaign in an increased effort, both in 2015 and in 2019. And during those times, we saw significant increases in calls to the quit line. During the first round, callers increased by 821%. And in this most recent round in 2019, there was less funds put towards it, but they still increased 116%. So we know that community education works, and it does drive people to action. So it's important that we stay the course with that and continue these messages. And then finally, expanded access to healthcare. State Medicaid programs are required to cover some cessation treatments for Medicaid enrollees. However, there's only 13 states, and proudly to say Kentucky is one of them, that has comprehensive coverage for Medicaid enrollees. So there's only 3, Kentucky, Missouri, and Wisconsin, that do this without any barriers. And so we certainly are providing these resources to our populations in Kentucky and getting them the access that they need. So while this data is really an important part of telling the story around tobacco and the impact it has on health in our economy, it certainly can't be used by itself, and it has to be used as a way to engage the community to put this data into action. And so Julian from our team is going to share some tips for authentic community engagement and how we take this data and put it to use to make some of those sustainable and long-term changes.
Thank you so much, Megan. As we can see here, we definitely just discussed some really interesting numbers that are very impactful. But a lot of times those numbers are only shared between organizations and not actually discussed with authentic community members. So it's really important that we can use these numbers to tell a story. These can be started to use as visual examples that really help convey the message. And these numbers can also help to build an outreach plan, not to use these numbers as, okay, we know what communities we need to go and try to do programs in, but we know what communities we really want to work to connect with. We really understand the need to make sure that we have true community engagement and community partnership in our programming, because though we might have expertise in tobacco, the people have the expertise on their community and on their experience in their community. So it's really important that we include them in all aspects of program planning. And it also is really important that we come up with new and unique ideas, especially in this new landscape. Things have changed for a lot of us, but it is really important that we start having conversations. An example of this is there are some organizations that are finding ways to really do like mobile tea carts with includes an art project. So what they are doing is they are having people paint teacups and then offering to have conversations in tea in an outside environment, which can still be socially distant. This is just one way that you can really start to build that community connection and really build that trust with the community before trying to do any type of implementing of a project or a program. We really understand the need to make sure that we are really engaging with the community and really making sure that they see us as a trusted value partner in all things that we do. And we want to make sure that there is that true community input in all new projects and programs and stuff like that. And when you have those things and have that community involvement and that community voice, there's can be a lot of openings for things such as funding to make sure that progress and programs and stuff can happen. So, asking you, and please, we would love to hear from you in the chat box. What does successful community engagement look like to you? What are some tips for engaging communities? We would love to really know your thoughts.
Thank you so much, Julian. And like you said, please feel free to share. I think, community engagement, authentic community engagement requires creativity and requires sharing with one another. So I know I personally am always eager to hear what's worked for folks or what hasn't worked, and especially in an environment like we find ourselves in now. Great. So now that we're grounded in that data, in that context, let's talk about what's happening in Northern Kentucky around tobacco use. I'm going to invite our panelists here to join us now. We'll turn off the PowerPoint and go into speaker mode for this conversation. And we'll be answering audience questions during this portion of the event. So please, please, please chime in with your questions in the chat box. And I would like to welcome Dr. Lynn Sadler, like I said, District Director of Health in the Northern Kentucky Health Department, Tony Cox, Director of the Brecken County Health Department, Brent Cooper, President and CEO of the Northern Kentucky Chamber of Commerce. Thank you so much for joining us today. And we're going to start with Dr. Sadler. I have a question for you. Public health is obviously in the spotlight right now with the COVID-19 crisis. But let's talk about the role of public health here. How has public health helped to drive some of the progress in reducing smoking over the past few decades? What's worked and where are we going from here?
Thank you so much for allowing me to be here, and I apologize, my voice is sort of given out. I think I've been talking a lot about COVID, and it's taking its toll. But I do want to say that, anytime something is the leading cause of premature death and causes a large amount of disability, disease, as well as death, such as tobacco use does, you better believe that public health is all over it and has been for decades. And as we have seen some progress throughout the country, and even here in Northern Kentucky and throughout the Commonwealth, it's important to note that we still need to keep moving forward. The data is very clear that we have not reached the end zone on this issue yet. And so as far as public health goes, a number of the things that were brought up today are exactly the strategies that we have employed, whether it's working on policy change and advocacy, both at the local level, at the state level, at the federal level, and having some success. The Williamstown Comprehensive Ordinance, the statewide law for tobacco-free campuses for schools, things of that nature. And we don't do that by ourselves. As Julian mentioned, everything we do is in the context of coalitions and coalition building and community. And you can clearly see that there are a majority of people in Northern Kentucky who see things the way that we do, and that change is needed. We need to change our environment, and we need to move forward together in making it easier for people to quit smoking. The other couple of areas that we focus on, educating, empowering people with the information that they need, making smoking cessation more readily available and overcoming barriers, particularly for low-income people, people in rural areas, because health equity does play an important role in this issue.
So much.
Great, thank you.
Megan, did you want to
Thanks,
jump in with a question?
Sure. Yeah, really appreciate your thoughts, Dr. Sadler. So now we're going to switch over to Tony with the Bracken County Health Department. I know we talked a lot today about the culture of tobacco use in Kentucky. And so interested in your perspective from leading a health department in a more rural community. What are people talking about as it relates to tobacco, and how are you approaching these conversations about tobacco in your community, especially when, you know, it is such a part of the culture for years?
Thanks for asking that question, and thanks for having us on. We are certainly in a rural area here, and the conversations have changed. They've changed. They certainly haven't changed enough. We believe that the landscape begins to change from one of the things that I can remember even 5 years ago, the conversation of smoke-free was something that if you brought that up, you didn't get on agendas in meetings. It was just something that they did not want the conversation to take place. Policy makers really, they just did not even want to even understand what the numbers were. And then we would always hear this phrase that, it paid for, and then you fill in the blank. It paid for my college education. It paid for my home. It built this family farm. And so one of the things we've been looking at from a cultural standpoint, and the conversations are shifting somewhat, is that to try to get tobacco in general conversation, from being about tobacco being a provider to people to it being a problem for people. And it's interesting that there are people will look at these numbers and you can tell they're a little taken back by them. They don't, there are a majority of people in our community that are for smoke-free. Many of our businesses now, to be a really small community, that are supported by farmers, even tobacco farmers now, are smoke-free businesses. There's a few that are still not, but it's not, you're not going to be pushed out of the room anymore when you bring that conversation up. And it really is something I was thinking about that someone said about why are doctors not asking all of their patients? Well, we have heard people say in some of our community meetings about this overall conversation that if their doctors keep bothering them about smoking, then they just don't go to the doctor for anything. And so I realize that's a little hard to understand sometimes, but when you are entrenched in that tobacco culture, you'll just ride with whatever it is that's going on instead of somebody, what I wouldn't call it nagging, I would call it caring about somebody. But that's kind of how that they look at it. But I really and truly do believe that the conversation is shifting in the rural areas, but we have a tremendous amount of work to do, and especially looking at the lower income families. The numbers bear it out, and it's absolutely true here.
Great. Thanks, Tony. I'm glad you brought up the piece about being advised by a healthcare provider. I saw that come through and a little bit of discussion about that in the chat. And I think, what you shared certainly. And then a lot of times we hear that, physicians have a lot of things to tackle in an appointment, and a lot of times they have 15 minutes, and tobacco doesn't become their top priority, unfortunately. And then also, I know when I was working in Northern Kentucky 6 years ago, there was still talk of some physicians that smoked in their offices. And so just because they're a physician doesn't mean that tobacco isn't part of the culture. It certainly is still ingrained no matter what profession you're in. So there's definitely work to do there, but it is, an uphill battle in some of these communities. So thanks for sharing your thoughts, Tony. Now to kick it over to Brent. So when you hear about these data and about tobacco use, secondhand smoke in the Northern Kentucky region, what do you think about from an economic and business perspective? We're talking about things related to retention, talent, recruitment, workforce health. I know this is something you're passionate about and would love to hear your thoughts on how tobacco plays into that.
Yeah, thanks a bunch. As I look at the data, it's just, I put a comment in the chat. It's staggering that the impact on costs for our community, for our state, for our region. You look at those numbers, and somebody else put a comment on there about the Medicare costs. We're trying to convince elected officials at the city, the county, and the state level of these costs. All of our government agencies employ people, and so when you have higher Medicaid costs, lower productivity, higher insurance costs, it not only impacts businesses, it impacts government, it impacts us all. And I saw almost 3 out of every 4 Northern Kentuckians believe we need to reduce smoking and have smoke-free laws. They're in support of that. How is it that we don't yet have that for some of our cities, for some of our counties, for our state? It's staggering to me. And in the business community, those numbers are even more telling. The vast majority of business owners feel like we should have smoke-free, that we should have policies that make sense. We advocated for an increase on cigarette taxes. Why? Because every single place that raised cigarette tax by at least $1, kids smoking went down. So yes, there are some businesses that sell cigarettes that felt like that was an additional tax on them. We understand that, but the rest of us are paying for the number of smokers in a big way. And if we can reduce that, it helps us all. So it's something that I've been very passionate about, something our Chamber of Commerce is very passionate about. We just have policies in place, or lack of policies in place, that just don't make sense to us. Smokers as a protected class. We don't have smoke-free laws comprehensively here in Northern Kentucky. And we feel like the cigarette tax should still be raised again, and that should be something we constantly look at. Without doing those things, we're never going to dramatically reduce smokers, as you said, 24% in Northern Kentucky. That's heart-wrenching. National average is 14%, so we're hell and gone from that. And then when you look at the cancer rates, that's reflected. That's why we're some of the worst cancer rates in the country. Last I saw, for lung cancer and for everything else, we were 50th out of 50 states. So if we're ever going to make a difference, we've got to start making common sense decisions regarding public policy. And as a small business owner, I'll say this. I have had smoke-free at my campus for some time. I know it's inconvenient for some employees, but you know what? It's good health. Good health is good business. And I have the rest of my employees to take care of as well. Secondhand smoke from e-cigarettes, from regular cigarettes, that causes damage to my other employees, and I won't have it. And I hate that. I know it's inconvenient to have to go off our property to smoke, but we all have to collectively do that because we're worried about the whole and our entire company. And I hope, as this data gets out, I hope the businesses see that it'll help your productivity, help lower your insurance costs, will make your workforce collectively much better.
Absolutely. Thanks, Brent. And I appreciate as a small business owner that you're modeling that behavior and so passionate about sharing it with others. Julian, do you have any audience questions that have come through to share before we do some additional?
Well, there's a lot of questions regarding the role of healthcare providers in recommending people to quit smoking, as well as some people really talking about how people are still smoking when the data has been around for many people, and we discussed that a little bit in culture. Another thing people are asking about is kind of talking about the role of changing the discussion from tobacco as a provider to tobacco as a problem. And in that way, how does that happen? Like, how do we change that discussion? Where is that tipping point to where we start seeing that change? If anybody wants to kind of speak a little bit more about that.
I'll chime in just a little bit on it. If
Thanks,
somebody
Tony.
else, is there somebody else trying to talk?
All
Oh,
you,
okay.
Tony.
All right. Well, not all me. Don't do that. But uh, we all know that changing a culture is very difficult, and it's something that it takes a while. But the approach that we kind of look at here is to let that kind of be a driving, those simple little words to kind of drive the different things that we may be doing, from the videos that we've put out to surveys that we're doing in the community to, where COVID has kind of kept us from doing a lot of our community events that we've had planned. But I think one of the approaches to this is that part of it is taking care of itself. Now, let me tell you what I mean by that. As the generations are not in tobacco farming as much, and a lot of the families, as they grow, they are going to college and doing other things, and some of the tobacco farms are certainly changing, and so that changes it almost automatically to that. But I think that you have to show the issues with health and the cost of health. And it really bothers me when I look at numbers and understand the significance in the smoker rates with the lower income families. Because there's not a subject that we could pick out and talk about that's not affected by so many in that group, and most of it is tied, if not a lot, is tied to tobacco smoking. So from that standpoint of trying to talk about, that your insurance costs could very possibly be driven down. Things that are, with businesses and trying to help them, because we have a significant number of people that are for smoke-free policies and don't like secondhand smoke. So I think all of that together goes into the part of driving it to become more of seen as a problem versus something that's building houses, that's buying farms, that's putting people through college. And it's just going to take some time to do that.
I would add that, we bring people from around the state and from around the country and from around the world to Northern Kentucky. And they are often flabbergasted that we don't have smoke-free policies in place, that we are the lowest for sales tax on cigarettes of our surrounding states. Lexington, Kentucky, for example, has had a smoke-free law forever, well over a decade, I think 14 years, something like that. Louisville, same deal. Cincinnatians have smoke-free. Their bars and restaurants are doing just fine in terms of it doesn't cost them business to have those policies in place. And London, Kentucky has a smoke-free law. Moorhead, Kentucky has a smoke-free law. How is it possible that we don't hear? It jumps out at you, and we have people that we bring in from around the country, and they look at our cancer rates, and they look at those statistics that we just shared, and they shake their head. You say you prioritize health, and you say that you care about an improved workforce, and yet you don't have policies to back that up. And so I think that's another piece of this. I think from an economic development perspective, I do think it would help our image. I'm tired of being looked at as the smoking section for Greater Cincinnati. I want to be a place that prioritizes health and is seen that way and lives and breathes it.
And I just wanted to jump in and round it all out with, it's so true. We talk about the tradition of tobacco and the history of tobacco in Kentucky. And as Tony mentioned, that is part of our history, and it has provided a lot of those things. But we need to look going forward, as he said, it is the problem now. And so we need to look at how do we continue to transform our social norms to the point where people are engaged in creating the change that we need to see, and honor the past, but look at what our destiny is. And it's my understanding that farmers in Kentucky have been and are continuing to diversify the crops that they plant and harvest, and so tobacco is becoming less and less of the cash crop that it once was. And so, folding all that in together, I think is really important, because we do need to look at what do we want to be and where do we want to be, particularly here in Northern Kentucky when we have so much going for us, and to make sure that nobody is left behind in this. And I noticed there was some questions about, how can people in rural communities access cessation services, and there's been some good answers on there about free services that are available, services that are available virtually, because everybody needs something a little different to help them with quitting. And so definitely the quit line, and for people in our health district, you can get two weeks of free nicotine replacement patches when you call the quit line. Having those virtual freedom from smoking sessions, so that people get that extra support in their efforts. So I just wanted to make sure to point those out as well.
Thank you so much for those for that conversation.
I appreciate it. I think Dr. Sadler, I'll stay with you, and really, we can't leave here today without talking about COVID. So I was just wondering if you could tell us a little bit. What do we know about the connection between tobacco use and COVID-19? What can we do about it just based on what we know today?
Yeah, sure. It seems kind of intuitive when you think about what tobacco use, smoking and vaping, the effects that they have on your respiratory system, the damage that is caused, the inflammation that is caused. And so it seems sort of intuitive that would likely cause issues if you became infected with COVID, the virus that causes COVID-19, or even the flu, amongst other kinds of things. And the body of evidence is growing to affirm that sort of intuitive belief. And we are seeing that, according to the research, more and more people who have smoked, are smoking, are vaping, are at increased risk for serious complications from COVID. And so one of the campaigns or messaging that we want to get out right now is, we talk about the face coverings and the social distancing and the hand washing, and we've been pushing people to get their flu shots this year because we know of the challenges that your body is going to have if it's having to fight off flu and COVID. But we need to also add in there that if you're smoking or vaping, now is the time to quit, and make sure that we promote the resources that are available and why it's so important to quit now. There are lots of other excuses to quit and reasons to quit, but here's one that's very time sensitive.
Absolutely. And I think we've seen some great conversation about some cessation resources. I'm going to actually, Megan, you've been chiming in a little bit. Do you want to touch on those briefly? And then if you have another question, I'll let you move on with that.
Sure. Yeah. So we got some questions specific about programs for cessation services in rural communities, both, as people have trouble accessing because of distance or because of COVID concerns. Diane Coleman from Three Rivers chimed in, which was really helpful, about access to quitline services either by telephone or online, and that those are free and they can get free nicotine replacement products, as well as, I think Dr. Sadler also mentioned, freedom from smoking. And then we have seen both the Northern Kentucky Health Department and the Three Rivers District Health Department do some great work with some of our local family-owned pharmacies in the region. So when we've done it in both urban and rural environments. So Covington's done some great work, but also Grant County and Gallatin County of getting people access to cessation services and products at their local pharmacy, which is a trusted source. And then someone did ask about quitline services for youth who vape. And there is a program specifically developed for youth called My Life, My Quit. They can text in to start to get access to their services, as well as access those online. So, and then Stephanie just shared a handout of quitlines available in Kentucky that highlights those different programs. So be sure to check out the chat box. There's a link there for that, as well as a link to a web page on our website about vaping resources. So kick it back over to Brent with some more policy discussion. We've shared a lot about secondhand smoke, tobacco use rates. So curious what you see as what local strategies could make a big difference in Northern Kentucky. We've heard that people support smoke-free policy. Is this a place to start? And then I'll kind of tie into, someone mentioned, we need to promote public policy, but how do we also balance that with supporting those that do have an addiction and making sure that we're keeping everyone in mind and that we're not alienating folks?
Sure. So for my part, I think this is a great way for our local city and county officials to take a look at this data and see what their citizens are saying, how they do prioritize health, that they are talking about this as an issue and as a problem for the region. Again, these data points, again, when you look at 14% national average smoking, but in Northern Kentucky it's 24%. I mean, that's a big number, I think, and it puts us, as one of the worst places in the country for smoking, and so we've got to find a way. I will also add that, I didn't talk about the infant mortality rates, but one of the things that impacts infant mortality rate is smoking by those that are pregnant. And so we know that if you have an increased amount of smokers, your infant mortality rate is going to increase. And ours is not good compared to the country. I think in the county I sit in, I think it's a 10. For the United States, it's something like around 5. As a state of Kentucky, where it's 6. And compare that to other countries. Ours is the state of Kentucky's is twice as bad as Germany's, for example, or France, or almost 3 times as bad as Japan's, for example. So those are things that we've got to, share this information with folks, get them to take a second look. I do think this is an opportunity to do exactly that. And I'll also say on the business side of things, we need to make businesses better businesses. One of the ways they can kick in on this is to continue to provide smoking cessation programs within their organizations to help people along, perhaps like my company's done. We provided financial incentives for those to quit smoking. So we'll give you $500 if you quit, that kind of thing. So I think there's ways that businesses can also kick in addition to being smoke-free themselves and take a lead that way. I think they could try to make their workers even healthier through other incentives.
Great, that's some wonderful insight, especially coming from a small business owner and what you're able to provide to your employees. Kelly, did you have another question that you wanted to jump in as we start to wrap up here? And certainly, if anyone has other questions, please put them in the chat because we have about 10 minutes left.
Yeah, I had a question. I wanted to kick it back over to Tony and just have you talked a little more about, what stood out to you about these data, what's happening in Bracken County and in rural communities for tackling some of these issues from, whether they're policy efforts or, access to cessation services. What do you see happening right now?
Kelly, thanks for that. I think there's 2 things that we're beginning to focus on. I know there's been a lot of discussion by a lot of people because of COVID, and it's on so many people's mind, even with policymakers and people in the community. And I think it's time now, Dr. Sadler discussed that as that data is beginning to start to come out. It's time to get back in the front of our people, at least in our community. We feel like that we've had some pretty good success with, and I mentioned businesses earlier. We're going to be going back to that area and doing some more work with that. We did a newspaper campaign to where that all the different businesses got free advertisement. And what we're trying to do is to build off of that, because what happened is that being in a small community, everywhere you go, whatever we're pushing at the health department is what people will stop us in the store and ask us about. And we've learned that if we want to bring up a discussion in the middle of the grocery store, just start talking about it and they'll stop us. Good or bad, they will stop us. So we want to go back to that approach and promote the businesses, more looking at a positive approach, not always a negative, going after the smoker, and showing that it's makes for a much cleaner, better place. Because the secondhand smoking numbers really bear that out, that people do not want to be dealing with secondhand smoke. The other thing that we're getting ready to try to do is we felt like we were a little bit of a disadvantage when we went to our WIC families. We have a pretty good WIC that come into our building that don't come into our building anymore. And that was a big population that we talked about smoking with that group. You talked about the infants and new babies and pregnancies. And so we still would do that on the phone, but it wasn't like that eye to eye peer contact. You can talk to them. So we're kind of trying to relook at that and how we want to do that from doing our virtual visits, and then trying to build back up our cessation program. Many years ago, and some of you will remember the Cooper Clayton years, we did pretty well with that here in our area. And, of course, that program we no longer use anymore. And so we're getting ready to try to survey the population of smokers and trying to figure out when our local docs began to write the scripts, we lost people coming to our cessation classes. And it's been a struggle to build it back. So we're going to be going after that again to try to get that going again. And how can we do that virtually? Of course, we use the quit line and what everybody's talking about, but it's time to get it back out front and try to have a positive message to move it to change.
Great, thanks, Tony. And we had a question pop in. So I was curious, we've talked a lot about smoke-free policy. We've talked a lot about this data. We've talked a lot about changes that we all are hopeful for in Northern Kentucky. So I'm curious, and anyone feel free to chime in on this one, but I'll kind of put it out there. What is different now? Partners in Northern Kentucky, many of you have certainly been working on this for years, for over a decade. So what's different now? And what do you see, to tie in some of the audience question, what do you see as the right messages? What resonates the most with policymakers? And what can we do to get to that change now? Despite, years of working on this, what makes the time right? And what are those right messages? Brent,
Well,
Dr. Sadler, I'm sure both of you have thoughts on this.
right. Well, I'll chime in that, I think at the Northern Kentucky Chamber, there has been an increasing amount of recognition that we need to start doing more than we're doing. And that has taken place over a number of years as this data has come out and as it's gotten more and more profound. Again, 3 in 4 Northern Kentuckians feel like we need, smoke-free law, and you look at the data on the economic impact for the state, on the Medicare impact on the state, on the worker productivity numbers. As we see more and more of this data come out, I think it's a really compelling case for businesses, but also, again, for local mayors, county executives, and at the state level, for at really all levels, for me. I think as everybody starts to see this more and more, and we've got to continuously bring it up and explain to people how this is impacting their everyday lives in ways that they often don't see. You don't, for company, most small businesses don't think about, while it's their single biggest expense, by the way, health insurance, they don't think about it every day. They're worried about their product and their, all the other things that we've got to deal with as small business owners. And so this is an opportunity for us to get in front of them and say, hey, this impacts your greatest expense right now. And for my company, we pay more in health insurance than we do for our travel, our rent, our utilities, everything combined. That's how much we're spending on health insurance. And I've been in business 21 years. It's gone up double digits almost every year except for 2 years in 21 years. And so that's why. That's what, it's expensive. And if we can find a way to collectively reduce that for our state, for our region, that's good business. And so we've got to spread that word.
And I just wanted to add in there, I think what is different now, part of what is different now is that there is very powerful collaboration going on. Brent has been a huge advocate for years when it comes to health of the workforce, and he understands the importance of the health to the bottom line for every business and for economic development in Northern Kentucky. So Brent has been a phenomenal partner in this effort to try to make Northern Kentucky the healthiest region in America. Having St. Elizabeth under Garen Colvin be such a strong and powerful partner, I think, when I walk into a room or go to an elected official, they expect me to talk about tobacco use as an issue and how it's impacting health and whatnot. But when business leaders talk to them about it, when the average citizen, their constituents talk to them about it, they listen in ways differently than when I talk to them about it. And so I think it really goes back to some of what Julian was saying, that we have got to be able to tap into Northern Kentucky residents and our leaders in the community to be able to move forward together with changes that make sense for making Northern Kentucky healthy and just all around a great place to live and work and play. So I think those are really some of the key pieces as we move forward to strengthen in those areas.
Thanks so much, Dr. Sadler. We are close to the top of the hour. I think you perfectly sort of summed up where we are and where we're going. I think that for all of us to think about our spheres of influence and what we can control and sort of what progress could look like in our community. Today can be another starting point using these data in our communities and to make progress and change together. Again, reflecting on all those awesome favorites and assets that we think about in Northern Kentucky. So again, thanks so much for being here today to talk about this important topic. Thanks so much to Tony and Brent and Dr. Sadler, the entire Interact for Health team, President and CEO of Interact for Health, Dr. Odell Owens. The report is up on Interact's website, looking good up there. So please check out the full report. I'll also be sending out a link to download it in a post-event email. Also, be sure to check out our website. There's more data and reports, like I said, from the tobacco survey. We also conduct other surveys, like the Kentucky Health Issues Poll. And so there's just a wealth of information there, as well as more information about funding opportunities as they become available, both within the tobacco focus area, but also in our other work on opioids and school-based health centers. Again, don't hesitate to reach out to any of us with questions. Thanks and have a great rest of your afternoon. Bye-bye.